It's been almost a year since the World Health Organization declared COVID-19 a pandemic, and here in the United States, we now have more than 28.7 million confirmed cases today. That number hard to wrap our heads around. Joining us right now, ABC News Chief Medical Correspondent Dr. Jen Ashton with a Health Insider look on how to navigate through this pandemic. Dr. Jen, I want to thank you for being with us again today. Now, we addressed this earlier in our newscast. Recently, Texas and Mississippi, two other states, have decided they're eliminating mask mandates and allowing businesses to operate at full capacity. You're a practicing physician. You've been covering this pandemic since day one. I'd love to get your thoughts on this.
Well, first of all, it's good to be with you. You know, I speak to Dr. Anthony Fauci on a regular basis, as I have for over the last year in covering this pandemic. And, you know, both from what I learned from him and other top infectious disease specialists, and also the advice that I, as you say, give to my real life patients, the science and data just does not support that this is a good idea at this point. We all want to do this, there's no question, but we have to distinguish between what we want to do and what we should do. And going back to 100% normal capacity for things in our society while taking masks off is really like taking a match to a fuse for a powder keg that we've already seen in the past year absolutely has the ability to explode and explode in a big way.
Yeah, it's a good analogy. And of course, we don't want to regress either. We want to keep the progress and build on that momentum. Now, when it comes to getting vaccinated, President Joe Biden now says that there should be enough vaccine for adults by the end of May, for all U.S. adults. What do you think about that? Do you think that everyone will be vaccinated at that point? Or is there sort of a labor issue with that? Meaning, do we have enough people to actually give those shots in arms?
It's a great question. You bring up really probably the most important point, which is there's a big difference between producing vaccine, shipping it and distributing it, and then administering it. First of all, you know, we know that about 30 to 40% of the U.S. population has some degree of hesitancy. That's in keeping with the percentage basically who chooses to take an influenza vaccine every year. You know, and this is an urgent situation. It's a national health emergency as well as a global health crisis. And when you talk about whether we have the systems in place to really operationalize that endeavor, you know, it's to be determined. We have to see if we can operate a lot of these vaccination centers 24 hours a day. That will help with the pace of this administration. And again, it's really about getting those vaccines into people sooner rather than later, because time is of the essence. Remember, it takes a while to get the full immune protection after a vaccine. So there's a big advantage to getting vaccinated on Monday than at the end of a week, let's say, because every day matters.
Certainly. We have about 30 seconds left, Dr. Jen. Do you think we can reach herd immunity by the summer, maybe?
Well, you know, I have no one has a crystal ball, myself included. I think the numbers you gave at the start with the number 26 million approximately known confirmed cases, 30 million, that's about 10% of the U.S. population with 500,000 COVID-related deaths. If you wait for that to sweep through the country, you know, multiply 500,000 by 8, that is absolutely unsustainable. So we hope that we can get vaccine-induced herd immunity, but only time will tell.
All right, Dr. Jennifer Ashton, ABC News Chief Medical Correspondent. Dr. Jen, thank you so much for being with us. You always break it down in a way that is easy for us to understand. We appreciate your insight.
Thanks so much for having me. Pleasure.
Take care. Stay safe.